Hello, my name is Joudi Al-Hajj and today my presentation is going to be about the insight into diabetic retinopathy, specifically exploring the power of optical coherence tomography imaging. Diabetic retinopathy is a compilation of diabetes affecting the retina, the light-sensitive tissue at the back of the eye. It is caused by high levels of glucose in the blood, which can damage the blood vessels that supply the retina. This damage can induce a number of changes in the human body, including morphological changes, blood perfusion changes, physiological changes, and metabolic changes. So, at the whole organ level, the retina may become thicker due to the accumulation of fluid, blood, or other substances. While at the cellular level, there may be changes in the structure and function of various cell types in the retina. These changes can lead to cell death and damage to the neural network that processes visual information. With regards to blood perfusion changes, diabetes can damage the blood vessels in the retina, leading to formations of new blood vessels, leakage of fluid and blood, and even blockage of vessels. These changes can impair blood perfusion in the retina, leading to lack of oxygen and eventually cell death. In terms of physiological changes, diabetic retinopathy can induce changes in the way retinal cells respond to various stimuli, such as light, pressure, or chemical signals. For example, some cells may become hyper-responsive to light, while others become less sensitive. This can affect visual function and lead to symptoms such as blurry vision or difficulty seeing at night. In terms of metabolic changes, diabetes can induce metabolic changes in the body, such as alterations in the levels of glucose and oxygen in the blood. These changes can affect the function of retinal cells, which rely on steady supply of oxygen and nutrients to function properly. Here we can see an example of an image that shows the growth of the abnormal new blood vessels in the eye. Diabetic retinopathy can have significant socioeconomic effects. Mortality rates is one of them. While diabetic retinopathy itself is not typically fatal, it is a complication of diabetes, which is a major cause of mortality worldwide. In terms of disability, diabetic retinopathy is the leading cause of blindness in working-age adults worldwide. It can also lead to other visual impairments such as reduced visual acuity, double vision, and distorted vision, as we could see in the first slide. These disabilities can have significant impacts on the individual quality of life, ability to work, and independence. The prevalence of diabetic retinopathy varies depending on the population studied and the criteria used for the diagnosis. In Canada, it is estimated that 3.4 million people have diabetes, and approximately 1/3 of them have diabetic retinopathy. For social impacts, the high rates of diabetes and diabetic retinopathy place a significant burden on the healthcare system and governments. The cost of treating diabetes and its complications is substantial, and it's estimated that the economic burden of diabetes in Canada exceeds $17 billion per year. Addressing the growing diabetes epidemic and its complications require a multifaceted approach that includes prevention, early detection, and effective treatment. Diabetic retinopathy is diagnosed through a comprehensive eye exam by an optometrist. The exam might include patient history, functional history, visual activity measurements, color vision evaluation, binocular vision assessment, eye health assessment, neurological assessment, and refractive correction. The most current methods for diagnosing diabetic retinopathy include dilated eye exams. During a dilated eye exam, an eye care professional, like an optometrist, will use special instruments to examine the retina and look for signs of damage, such as abnormal blood vessels, swelling, or bleeding. Optical coherence tomography, or OCT, is an image technique that uses light waves to create detailed images of the retina. It can help detect changes in the thickness of the retina and identify areas of fluid accumulation. Fluorescent angiography is a test that involves injecting a special dye into the bloodstream and taking photographs of the retina as the dye circulates through the blood vessels. This can help identify areas of abnormal blood flow or leakage. These methods may not be able to detect early stages of diabetic retinopathy. However, these methods are non-invasive and can provide detailed information about the state of the retina. The most current methods for treating diabetic retinopathy include laser therapy, intravitreal injections, vitrectomy. First, laser therapy involves using a laser to seal leaking blood vessels or destroy abnormal blood vessels in the retina. It can also be used to treat macular edema, a common complication of diabetic retinopathy. Intravitreal injections. These are injections of medications into the eye, typically performed in a clinic or hospital setting. Medication can help reduce inflammation and swelling in the retina, improve blood flow, and prevent growth of abnormal blood vessels. Vitrectomy is a surgical procedure that involves removing the vitreous gel from the eye and replacing it with a saline solution. This can help clear away blood and other substances that may be clouding the vision. These methods can be effective in preventing or slowing the progression of diabetic retinopathy and improving vision. However, these methods may not be suitable for all patients, especially those with certain medical conditions that may increase their risk of complications. To suggest some potential improvements to better diagnose diabetic retinopathy, I would suggest higher resolution imaging because high resolution OCT imaging could help ophthalmologists and optometrists detect subtle changes in the retina that may be missed with current imaging technology. This could lead to early diagnosis and treatment, potentially reducing the risk of vision loss and other complications. The second suggestion is automated analysis of OCT imaging. Developing software that can automatically analyze OCT images and provide diagnostic information could reduce the burden on the ophthalmologists and optometrists and improve the speed and accuracy of the diagnosis. Moving on, optical coherence tomography is one of the most commonly used imaging techniques for the diagnosis and monitoring of diabetic retinopathy. OCT, for short, provides high-resolution, cross-sectional images of the retina, allowing for the detection of subtle changes in the retinal thickness and identification of fluid accumulation or other abnormalities associated with diabetic retinopathy. The typical imaging protocol for OCT imaging of diabetic retinopathy involves a non-invasive, non-contact imaging procedure in which the patient sits in front of the OCT machine and places their chin on a chin rest to stabilize their head. The OCT machine emits near-infrared light that is directed towards the retina, and the light reflected back from the retina is used to generate a cross-sectional image of the retina. OCT has revolutionized medical imaging by providing clinicians with a powerful tool to visualize the internal microstructure of tissues and to track changes over time, enabling early detection and treatment of diseases. The following are the technical specifications of optical coherence tomography. The first is image resolution. OCT has high resolution, typically ranging from 1 to 15 microns, which allows for detailed visualizations of the tissue microstructures. Secondly, image signal-to-noise ratio. The image signal-to-noise ratio of OCT can vary depending on factors such as the tissue type, the imaging system, the imaging protocol used. Generally, the global signal-to-noise ratio is high, ranging from 50 to 100 decibels. Local SNR can vary across the image, with lower SNR at tissue boundaries and areas with high optical scattering. Third is image contrast. OCT can provide high contrast images of tissue structures due to the difference in optical properties of different tissues. The contrast in OCT images is primarily determined by the difference in refractive index and scattering properties between tissues. Fourth, imaging procedure. OCT can be performed in 2D or 3D. In 2D imaging, a single cross-sectional image of the tissue is obtained. In 3D imaging, multiple cross-sectional images are obtained and to reconstruct a 3D image of the tissue. Moving on, the image acquisition settings for OCT imaging of diabetic retinopathy can vary depending on the specific OCT machine used and the preferences of the clinician. In general, the following settings are often used. Number 1, scanning area. The OCT machine can be set to scan a specific area of the retina, such as the macula, optic nerve, or periphery. Number 2, scan patterns. The OCT machine can be set to use a variety of scan patterns, including linear scans, radial scans, and volume scans. Linear scans are often used to assess retinal thickness and the presence of fluid accumulation, while volume scans provide a more comprehensive view of the retina. Third, scan density. The OCT machine can be set to scan the retina at varying densities, ranging from sparse scans to dense scans. Higher scan densities generally provide better image resolution but may require longer scan times. Fourth, scan speed. The OCT machine can be set to scan the retina at varying speeds, ranging from slower scans with higher image quality to faster scans with lower image quality. Faster scans are often preferred in clinical settings to minimize patient discomfort and reduce motion artifacts. Fifth, image averaging. The OCT machine can set to average multiple scans of the same area to improve image quality and reduce noise. The OCT test consists of multiple scans, and each scan takes about 45 to 60 seconds. The total test time is between 10 to 20 minutes. As we can see in those OCT images, there is a change in the retinal thickness as well as changes in the reflectivity of the different layers of the retina. OCT image protocol for diabetic retinopathy often involves a 3D volume scan of the macular region, as we can see here. This allows for visualization of the different layers of the retina, including the macula, which is the area of the retina responsible for the central vision. The high resolution of the OCT allows us for detection of small changes in the retinal structure while indicating the early stages of diabetic retinopathy. OCT images are generated based on the interference of low coherence light waves. The signal strength of the interference fringes is used to generate an A scan, which represents a single line of data. By scanning the beam across the retina, a 2D or 3D image can be generated. The reflectivity of the different retinal layers determines the signal strength, which affects the image contrast and signal-noise ratio. The axial resolution of the OCT image is determined by the coherence length and the light source, while the lateral resolution is determined by the scanning beam size. Microaneurysms are usually the earliest visible manifestation of diabetic retinopathy. They appear as tiny red dots scattered in the retina. Here we can see the OCT image and fundus image showing the microaneurysm. There are several other imaging methods used for clinical diagnostics of diabetic retinopathy, such as fundus photography, fluorescent angiography, and indocyanine green angiography. For image resolution, OCT has a higher resolution compared to fundus photography, fluorescent angiography, and indocyanine green angiography. OCT can visualize details up to 5 to 7 microns, while fundus photography has a resolution of 20 microns, and angiography techniques have a resolution of about 10 to 15 microns. In terms of image contrast, the contrast of OCT images is high because of its ability to differentiate between different layers of the retina. On the other hand, fundus photography and the other imaging techniques have lower contrast, and it may be difficult to distinguish small changes in retinal structure. In terms of image sound-to-noise ratio, OCT has a higher sound-to-noise ratio compared to fundus photography and all the other imaging things. This is because OCT uses a low coherence light source, which allows for efficient collection of light scattered from the retina. In contrast, angiography techniques require the injection of dye, which can cause noise to reduce image quality. For complexity of the image procedure, OCT imaging is relatively simple and non-invasive. Fundus photography is also non-invasive, but may require the use of eye drops to dilate the pupils. Angiography techniques are more invasive and require the injection of dye and a longer imaging time. Complexity, size, and cost of the imaging system. For OCT imaging, they are relatively small and can be used in outpatient setting. They are low cost, effective compared to angiography systems. Fundus photography systems are also relatively small and cost effective. However, the cost of consumables such as dye and film can add up over time. To conclude, in this presentation, we discussed the importance of optical coherence tomography for the diagnosis and monitoring of diabetic retinopathy. We compared OCT to other imaging methods. We highlighted the technical specifications of OCT imaging and we propose potential improvements to the imaging procedure, including the use of automated analysis software for better outcomes.